Warm greetings from the High 10. It is Everyday Shenanigans on this Thursday, April 9th, 2020. I would like to bring you some information pertaining to the coronavirus. It is pertaining to the origin of that virus stimulating out of NYC. And the said information is by CNN Health. New York's coronavirus outbreak came from Europe and other parts of the United States, research projects suggest. Two separate research projects suggest that the novel coronavirus may have been circulating in New York City earlier than thought, and the earliest cases likely originated with travelers coming from Europe and other parts of the United States, not Asia. The new data come from the Icahn School of Medicine at Mount Sinai and the NYU Grossman School of Medicine. With more than 80,000 cases and 4,260 coronavirus deaths, according to the city's website, New York is one of the major epicenters for the coronavirus outbreak in the United States. On March 1st, New York Mayor Bill de Blasio reported the city's first novel coronavirus case had been confirmed. The patient contracted the virus during recent travel and is isolated in her home under close monitoring, de Blasio wrote in a Twitter post that night. Soon after, the city that never sleeps cautioned against public gatherings, and New Rochelle, New York, closed schools as the virus spread quickly there. Now, new data from NYU Langone Health suggests that the novel coronavirus has been spreading in New York for a couple of months now, long before testing started. And a genetic analysis of viral samples in the city indicate that they originated in Europe, according to an announcement from the Academic Medical Center on Thursday. And there's also a video in the said article if you need to watch it. The announcement notes that this early data was based on examining the genetic material of the novel coronavirus taken from 75 patients in New York City. Nasal swab samples were collected from the patients at Tisch Hospital, NYU Winthrop Hospital, and at NYU Langone Hospital, Brooklyn. As viruses evolve during transmission from person to person, their sequences can help researchers to zero in on the provenance or place of origin of that specific infection, Dr. Madhya Snudero, leader of the clinical testing team and director of molecular pathology and diagnostics at NYU Grossman School of Medicine, and in the announcement. The new data has not been published yet in a report, preprint paper, study, or peer-reviewed journal. We're just starting this project, but we'll soon be sequencing 192 viral samples per week with the goal of offering thousands of sequences for analysis in the near future. Adriana Hugai, leader of the research team and director of the Genome Technology Center at NYU Langone Health, said in the announcement. Hugai added in an email on Thursday that we want the whole community to have access as soon as we have the data. It's all hands on deck now. Separately, a preprint study from Mount Sinai published online Thursday at medRxiv and not yet peer-reviewed involves sequencing and analyzing 90 complete coronavirus genomes from 84 COVID-19 patients who sought care in the Mount Sinai Health System between February 29th and March 18th. The cases came from 2 towns in Westchester County and 21 New York City neighborhoods across Manhattan, Bronx, Queens, and Brooklyn. Those cases were analyzed along with 2,363 publicly available coronavirus genomes from around the world. Okay. The Mount Sinai study traced the cases in the city and found there's a limited evidence supporting that the virus was directly introduced there from China, where the coronavirus originated. China was under the United States' early travel restrictions in February. With increased testing, we observed the emergence of community-acquired infections from the majority of the community cases caused by viral isolates from clades that are of European origin, the researchers wrote in the Mount Sinai study. Taken together, we provide a first analysis of the SARS-CoV-2 viral genotypes collected from patients seeking medical care, the researchers wrote. We find that New York City is an international hub, provides not only a snapshot of the diversity of disease causing SARS-CoV-2 at the global level, but also informs on the dynamics of the pandemic at the local level. The findings in these emerging data that the novel coronavirus may have been circulated in New York earlier than thought, with most cases from Europe, are probably correct, the nation's top infectious disease expert, Dr. Anthony Fauci, said during an appearance on Good Morning America on Thursday. Europe became the epicenter pretty quickly after China really exploded with their cases, Fauci told ABC's George Stephanopoulos. We cut off the travel from China relatively early, and we were seated with a relatively few number of cases from China, but very quickly the epicenter switched to Europe, particularly northern Italy, said Fauci, the director of the National Institute of Allergy and Infectious Diseases. Given the travel and the air traffic from anywhere in Italy, but also particularly northern Italy, it's just not surprising that unfortunately and inadvertently New York was seated before they really knew what was going on, Fauci said, and that's why they're in the difficult situation that they're in right now, a very unfortunate situation. And this is brought to you by CNN Health. And I want to go back up here to reread something that was stated in the said article. Okay. Bear with me 1 second. So basically they're stating that from this new data from NYU Langone Health, that the coronavirus had been spreading in New York for a couple of months now, long before testing started, and the genetic analysis of viral samples in the city indicate that they originated in Europe, according to an announcement from the Academic Medical Center on Thursday. Okay. Okay. And then there's also this other study done from this pre-print study from Mount Sinai. And it's basically stating 90 complete coronavirus genomes from 84 COVID-19 patients who saw care in the Mount Sinai Health System between February 29th and March 18th. They were found in 2 towns in Westchester County in 21 New York City neighborhoods: Manhattan, Bronx, Queens, and Brooklyn. I can't even think. People arguing out. People are stupid. These people have no type of common sense. But anyway, this is my point, because I'm already 7 minutes in. Sorry to hold you. My thing is this: whether you found several people in New York City in a study, 1, 2 studies, whichever, that traced the virus back to Europe, well, we already knew it was going to be from somewhere. And whether you didn't test it early, well, you all weren't testing because you didn't think it was that serious. Let's just keep it 100. There were no testing done in New York, and just like other states, cities, and towns in America, because you were not jumping on board thinking it was all that serious. Our president didn't think it was that serious. So why would there have been tests? And we've already heard of people getting tests. Some getting tests, some did not. Some were sent home after getting the test and testing positive, and they went home to self-quarantine to only go back later worse at a said period of time, a couple days to a couple weeks, go back to the hospital. So you see, I'm not enamored at the fact that some people in New York testing led, the stats are saying Europe. My thing is, it was first diagnosed in China. How, where, whom, what animal, doesn't matter. Still was in China. Naturally, people in China were infected and left that general area, left that place, went other places such as Europe, and then people got infected there. So it doesn't matter to me if you want to say China, Europe, whichsoever. The point is the virus is here, and it only got, the stats got lowered in China because their country runs differently than here, and they put their people on lockdown immediately once they saw, I guess, the numbers jumping off. So they shut their towns and cities, they shut them down. We did not. Even when we knew of what was going on, our government knew what was going on in China. So you see, I'm not, I really don't care about the origin. The most people, or the few people that they've tested in New York, it's linking back to Europe. You understand what I'm saying? Because in the end, the virus is here, it's out, it's in Europe, it's in America, it's a few in China, over here, over there, it's all the same. It ain't left and it ain't went nowhere. And that's my main focus, is getting she out of him. That's what I care about the most. It's getting the virus out of here, getting a vaccination, getting a cure, and ways to help prevent this pandemic from happening again. And that should be the focus in our country, America, America the Great. A plan in motion for the next time this jumps off, or any other type of natural disaster. Resources already lined up. People who can help aid in giving information, getting the information out there. Vaccinations, all that. Do what you need to do. Don't sit and wait to see how something's going to jump out. Don't wait to see whether it starts here in America or it starts abroad. Already have a plan in motion to get things under control before they exacerbate. And that's what this has happened. Just because tests weren't done in January, February, what does that mean? Because we as the people don't have control over testing of a deadly virus. We didn't know that it was going to be people jumping off, falling down dead in America at the rate that it has, and abroad. How would we have known that? So it is up to our government to say, hey, this doesn't look good in China. Hey, this doesn't look good in Europe. We better start putting a plan in motion for our people and our citizens here, just in case it starts to jump off, such as the numbers there. That's how you do that. But as I state, and most of you know, when you don't have a cure, a vaccination, you have a mad problem. Because nobody knew how bad this disease was going to affect people and the different symptoms. Who knew? That's the sad information deriving out of New York. Prayers for those in New York City. Anywhere you have a major population of people, you're going to have a problem. And that's the reason why you're seeing more people sick there and passing away, because those people are jumbled up in that short, small area. See, a lot of people think New York is so big, the city itself. It's not. It's just a bunch of buildings holding people, a lot of people. You understand what I'm saying? The state is not even that big. But because you have so much square footage with people, as I say, toppled on top of one another in a small, dense area, it's no shock to a sane person that they have a serious problem with people being sick and dying there. It's too dense and it's too many people on top of each other. And you're going to see that anywhere where there's a lot of people living around one another. Prayers, condolences to those who have passed, prayers for our country and to those abroad, praying for all of you out there that you stay safe, keep your hygiene up when you go out. You know the drill, mask, gloves. And as I have seen today out, people are walking around with no mask, no nothing, no gloves, touching nasty buggies in the grocery store with nothing. One lady I saw, a Hispanic lady, she had 2 small children with her. You understand what I'm saying? And she wasn't covered up, nor were her children. And I thought, how dare you bring your kids outside with nothing on them? You could have left those kids at home with somebody and then came to the store to shop alone. Why would you bring your children out here and they're not covered up? So if you are to get sick, dummy, your children are going to get sick as well. And if one of the children gets sick, then somebody else in your household will get sick. And that's usually how it goes. But I see some of you out here, you don't take this serious. You're kind of like the government. You just thought what? A few people died. Okay, no big deal. Now it's April. And more people are still sick, and more people are dying. More African American people are dying in Georgia, New York, cities, Alabama, other places, and you all still don't take it serious. You're still running around in Walmart, grocery stores, gas stations with no mask, no gloves on, as if it is a joke. But see, it will not be a joke when your tail starts cooping and hopping and all that, gagging, can't breathe, then you're going to be feeling some type of way. And let me tell you something. Some of you need to check out Ricky Smiley's video that has gone viral. He basically put it down saying, as soon as you find out you're sick, you test positive, you better let somebody know ASAP. You better go on Facebook and tell all your friends and your family, because you will not be having anyone there with you if you are admitted to the hospital and you go down worse. There'll be no mama, no daddy, no sister, no cousin, no friends, nobody. You will be alone. You'll be quarantined. There'll be no friends. There'll be nobody there. And as he stated, you will die alone in that hospital room. So for those of you who think this is a damn joke, keep walking around out here with no protection. And 9 times out of 10, if you're bold enough to walk out here with what is going on, with no mask and gloves, you are also the same dummy that's going home, not washing your hands and touching your face, your cell phone, your doorknobs, your TV screen, everything. And you also probably got other people living in your house. And hopefully they're not stupid dodo birds. But even if they were smart, they're still dealing with a dummy who's coming around them sick. So they're going to be infected as well, because none of us know who is a carrier. Any one of us could be carrying the virus at this given moment, passing it on to the next victim. So don't think it cannot be you, because I'm sure a lot of people who lied up in those rooms barely breathing thought, how did it come down to this? How did I get in this situation? You people need to stop, because you're shameful to keep walking around here and not be protected, and standing around people gaping and hollering and screaming and all in their face talking as if this virus does not exist. Honey, she got a name. COVID-19, Corona. Stop playing. Stop playing. And the sad part about this, beside the people dying, is the fact that they can't even have a proper funeral. That it would have to be graveside services only, and people standing far away from one another. You won't even be able to have them in a casket unless somebody is willing to let the casket be open and let you go in one at a time to view the body. You see, I'm coming to see that it is selfish deeds that got us in this predicament in the first place, because some people were careless over there across that pond in their practices with food, raw meat, wild animals, endangered species, wanting to eat it, use it for other goods, whatever reason. And now here you all are in the free world, stupid as all get out, and still won't take the precautions and necessary steps to keep yourself and others safe. So you're no different than those people over there in China who got the ball crunk in the first place. And that's the spoken word. Like, share, subscribe. Drop your comments below. Thanks for joining me. God bless you, America and abroad. You all stay safe out there. Please wash your hands, everybody, and take the necessary precautions to keep you and others safe. Amen. God bless you. And this is Everyday Shenanigans. Bye-bye.